Bismillah ar-Rahman ar-Rahim. Our first lecture about labor analgesia. Definition of pain as an unpleasant sensory and emotional experience associated with actual potential tissue damage. Stages of labor. The stage of cervical first stage constitutes with the stage of cervical dilatation, begins with onset of regular contractions and ends with complete dilatation. Latent phase 0.3 cm, active phase 4 to 7 cm, and transitional phase 8 to 10 cm. يعني first stage constitute from the latent phase to the transitional phase, which end with 10 cm dilatation. Stage 2, second stage of expulsion, begins with the complete cervical dilatation and ends with the delivery of the fetus. يعني هسه stage 1 عندكم الفول dilatation. stage 2 هي stage of expulsion اللي هي delivery of the baby. stage 3 اللي هي placental stage begins immediately after fetus is born and ends when the placenta is delivered. stage 4 اللي هي تعتبر maternal hemostasis stabilization begins after the delivery of the placenta and continues for 1 to 4 hours after delivery. The physiology of pain in labor. First stage of labor, mostly visceral pain, dilatation of the cervix and distension of the lower uterine segment, dull aching and poorly localized, slow conducting visceral C fibers enter spinal cord at T10 to L1. يعني منا إلى هنا هذه من T10 to L1. هذه هي first stage of labor اللي هي visceral dilatation of the cervix اللي هي أغلبها visceral. second stage of labor mostly somatic. هذه second stage of labor اللي هي somatic. Distension of the pelvic floor, vagina and perineum, sharp, characterized by sharp, severe and well localized, rapidly conducting A delta fibers enter spinal cord at S2 to S4. هذه من S2 ل S4 هي هذه اللي هي somatic بالsecond stage of labor. Pain during first stage is visceral and therefore mediated by the T10 through L1 segments of the spine, whereas during the later part of the first stage and throughout the second stage an additional somatic component is present mediated by the S1 through S4 segment of the spine. البين intensity، شوفوا هذه الألوان اللي هي وردي فاتح، هذه المايلد، الأحمر اللي هو moderate، السيفير اللي هو رامز له هنا بخطوط. يعني هنا بالearly first stage of labor راح يكون عندنا moderate pain، وهنا الفيجر بي late first stage of labor راح يكون عندنا severe pain. pain intensity هنا mild moderate severe. هنا راح تشوفون هنا اللون الوردي مثل ما قلت لكم، هنا يعني mild pain راح تكون هنا بالlegs mild pain، البوث thighs العفو mild pain، بينما البرينيوم راح يكون moderate pain، والابدومين بالايرلي second stage راح تكون شنو severe pain. هنا نشوفوا during delivery ايش راح يصير عندنا، لانه راح يصير عندنا distension of perineum، راح يكون severe pain at the vulva and vagina راح يكون عندنا، بينما الابدومين راح تكون بالعكس شنو راح تكون moderate pain. Effects of labor pain: maternal hyperventilation, hypocarpia, uteroplacental vasoconstriction, increased oxygen consumption, increased cardiac output, increased blood pressure, increased maternal plasma catecholamines. ايش راح يصير عندنا؟ راح يصير عندنا fetal acidosis and hypoxia. هنا شوفوا هنا الماتernal pain، work anxiety etc. ايش راح يسوي لنا؟ يسوي لنا hyperventilation ويسوي لنا release of شنو cortisol and catecholamines. اثنيناتهم بالنتيجة شو يسوون uterine vasoconstriction, metabolic acidosis, left shift in oxygen dissociation curve. هنا راح يسوي لنا lipolysis and hyperglycemia. من يصير عندنا left shift in oxygen dissociation curve شو راح يصير عندنا؟ الauto transfer will decrease. راح يصير عندنا fetal metabolic acidosis. هنا من البداية من راح يصير عندنا hyperventilation راح يصير عندنا respiratory alkalosis، بالنتيجة راح يصير metabolic acidosis. هم شو تسوي لنا؟ تسوي لنا fetal metabolic acidosis. من يصير عندنا uterine vasoconstriction نفس الوقت راح شو تسوي لنا؟ راح تسوي لنا placental flow decrease, placental exchange decrease, also will lead to fetal metabolic acidosis. هنا من راح يصير عندنا release of cortisol and catecholamines، راح يصير عندنا lipolysis، free fatty acids راح عندنا تزيد، الفيتال free fatty acids increase, also will lead to fetal metabolic acidosis. release هنا of cortisol راح يسوي لنا hyperglycemia. من يصير hyperglycemia راح يصير عندنا fetal hyperglycemia and hypoxia، وبالتالي راح يسوي لنا fetal metabolic acidosis. اوكي لهنا هسه مفهوم. History. The first to use ether and chloroform for pain relief in labor in the United Kingdom was the eminent Scotch obstetrician Sir James Young Simpson, professor of midwifery at the University of Edinburgh on January 19, 1847. He administered ether to an obstetric patient and thus began a new era in the effective management of pain in childbirth. Regional anesthesia or regional anesthetic techniques were introduced to obstetric in 1900 when Oscar Kreitz described the use of spinal anesthesia. هسه احنا بين الباست وفيوتشر شو اللي صار عندنا؟ Does labor pain need analgesia؟ يعني اكو بالباست وبالفيوتشر نريد نشوف احنا هاي الليبر بين يحتاج نسوينا على يحتاج analgesia او لا. analgesia for labor and delivery always controversial. طبعا دائما اكو اختلاف، يعني ناس تقول انطي وناس تقول ما انطي. ليش؟ لانه كل وحدة اكو الها منافع واكو الها مساوئ. البirth is a natural process. Women should suffer. Concern for mother's safety, concern for baby, concerns for effect on labor. كل هذه الاعتبارات واحد يخليها بالحسبان من يريد ينطي. The ideal labor analgesia لازم شو تكون عندنا؟ الايديال لازم عندنا تكون good pain relief نحصل منها، no autonomic block, no hypotension, no adverse maternal or neonatal effects, no motor block, no effect on labor and delivery, no increase in cesarean section rate, no increase in forceps vacuum delivery. يعني أنا أكون المريضة من أسوي لها labor analgesia لازم أنا متأكدة سويت لها assessment إنه أنا ما راح تكون هاي البيشنت راح تصير cesarean section ولا راح تكون هي difficult labor أحتاج لها forceps vacuum delivery. Patient can ambulate, economical cost and personnel. labor analgesia عندنا pharmacological وعندنا non pharmacological analgesia. اللي هي non pharmacological analgesia اللي احنا نستعملها اللي تستعمل يعني قصدي حاليا اللي هي psycho prophylaxis, birth, partner, mother, relaxation and breathing exercise, tense, acupuncture, relaxation in warm water, hypnosis and intradermal water injection. شوفوا هنا هذه intradermal water injection شافوا ان هم من دا يسوون water injection ايش راح يصير عندهم؟ راح يصير عندهم analgesia for labor. هنا شوفوا هذه الووتر باث at 34 38 centigrade قسم عندهم comfortable against the skin, and 37 and 40 centigrade is best for other patients. non-pharmacological strategies transcutaneous electrical nerve اللي هي تنس يسموها stimulation. Two pairs of electrodes attached to women back at the level of T10 to L1. شوفوا هنا مثل ما بالصورة، هنا هذه الالكترود محطوطة. Low intensity نستعمل electrical stimulation is given continuously or applied by women herself as a contraction begin. يعني ممكن المريضة بنفسها هي تسوي التطبيق هذا. ومن تبدي اليوتراين contraction ايش راح تسوي؟ راح تبدي low intensity electrical stimulation. إذا قسم شايفيها بالعلاج الطبيعي نفس هذا الجهاز اللي هو بالعلاج الطبيعي، يبدي بالبداية low intensity وبعدين شوي شوي يصعدها، يعني تحس مثل النتلات خفيفة. Block afferent fibers and preventing pain to travel from uterus to spinal cord synapses and facilitate release of endorphin can be effective as epidural anesthesia. Carries no risk to the mother and fetus. يعني هاي تقريبا safe التنس. non pharmacological strategies بعد ايش عندنا acupuncture، هذه الأبر الصينية based on concept that illness result from an imbalance of energy. To correct the imbalance, needles are inserted into the skin at specific body points. Activation of these points lead to release of endorphins. Helpful in the first stage of labor. ذولا يستعملوها شوكت، يستعملوها بالفirst stage of labor. non-pharmacological other strategies اللي هي application of heat and cold. ذولا يستعملون cold sponge أو heat sponge. Heat application effective in relieve back pain and raises the pain threshold. To increase blood flow and relieves muscle ischemia. Increases relaxation. قسم يستعملون مكمدات، قسم يستعملون دول أكياس المي الدافئة أو المي الحار. cold application applied to the back, chest and face to increase comfort, slowing transmission of pain. non-pharmacological strategies sterile water injection. دول يستعملون مجرد water injection، يعني ما بيدراج أو فد شي. Sterile water injections are an effective method for the relief of back pain in the labor. The procedure involves a small amount of sterile water, 0.1 ml to 0.2 ml, injected under the skin at 4 locations on the lower back sacrum. شوفوا ذني هذه السايت مالت الانجكشن هنا، injection site هو ماكو فد شي، مجرد فقط sterile water يستعملوه. يقول يعني تحقق شافوا انه بيها نتائج تقلل البين عند البيشنت. الناركوتيك analgesic اللي هي الأوبيويد، هسه هاي pharmacological strategies act by decreased sensation of pain used for their analgesic effect. All drugs in this category cause CNS depression, respiratory depression. Narcotic analgesic include يا هي اللي هي البيثيدين والفنتانيل والريميفنتانيل والمورفين والترامادول، هذول كلهم هم narcotic analgesia. البيثيدين is the most commonly used analgesic in labor because it has additional sedative and antispasmodic actions. These make it effective not only for the relieving of pain but also for the relaxing cervix and providing feeling of euphoria and well-being. يعني مو بس مجرد انه هو relieving pain، لكن شو يسوي انه يساعد لنا cervical dilatation and provide feeling of euphoria and well-being. narcotic antagonist اللي هو النالوكسون، يعني احنا من ننطي بيثيدين لازم احنا نسأل دائما عندنا antagonist موجود لو لا، حتى ليس الإفكت on the baby. عندنا بعد advantages and disadvantages of narcotic اللي هي opioid administration. advantages an increased ability for a woman to cope with labor. The medications may be nurse administered، ممكن حتى الناس تنطيها. It has no amnestic effect but create a feeling of well-being or euphoria. Disadvantages: frequent occurrence of uncomfortable side effects such as nausea and vomiting, pruritus, drowsiness, and pain is not eliminated completely. Nausea and vomiting, they should always be given with an antiemetic drugs. لازم ننطي وياه نعطي antiemetic حتى نتحاشى السايد افكت مالته اللي هو disadvantage اللي هي النوزيا والفوميتنج واللي هي جدا مزعجة للمريضة. Delay gastric emptying increasing the risk of if general anesthesia is subsequently required. Short-term respiratory depression of the baby. Possible interference with breastfeeding. Patients tend to be given tend to be given as an intramuscular injections. However, an alternative is a subcutaneous or intravenous infusion by a patient-controlled analgesic. الانهاليشنال analgesia اللي هي عندنا nitrous oxide in the form of Intonox, an equal mixture of nitrous oxide and oxygen. The advantage it has a quick onset, a short duration of action, and is more effective than pethidine. أكثر فعالية من pethidine. Disadvantage may cause light headedness and nausea. Hyperventilation may result in hypocapnia, dizziness, and ultimately tetany and fetal hypoxia. Not suitable for prolonged use from early labor because it is most suitable later on labor or while awaiting epidural analgesia. يعني ما يصير احنا نستعملها prolonged use من بداية الليبر أنطيها للمريضة. Regional analgesia, epidural analgesia, spinal analgesia, combined spinal epidural analgesia, continuous epidural analgesia, continuous spinal analgesia, paracervical block, lumbar sympathetic block, pudendal nerve block, and perineal infiltration. هذول شنو كلهم regional anesthesia يعتبرون. هنا عندنا lumbar epidural or spinal block. شوفوا level at the level of T10 زين لحد L1. different uterine pain pathways. عندنا paracervical. هنا عندنا block ممكن نسوي levator inner muscle block. هنا ممكن pudendal nerve block نسوي. راح يسوي لنا بلوك إلمن، يسوي لنا هذه البودندال نيرف فايبر، أو كودال بلوك نسوي. The main indication is for effective pain relief. There are another maternal and fetal conditions for which epidural analgesia would be advantageous in labor. These are prolonged labor, maternal hypertensive disorders, multiple gestation, certain maternal medical conditions, a high risk of operative intervention. Not suitable for early labor, restrict mobility or late labor, imminent labor. الإبيديورال analgesia هذه اللي هي احنا نعطيها بالإبيديورال. Regional anesthesia and analgesia. Epidural analgesia may facilitate an atraumatic vaginal breech delivery, the vaginal delivery of twins infants, and vaginal delivery of preterm infants. Facilitate blood pressure control in pre-eclamptic women. Blunts the hemodynamic effects of uterine contractions, for example, sudden increase in cardiac preload, and the associated pain response, tachycardia, increased systemic vascular resistance, hypertension, hyperventilation in patients with other medical complications, for example, mitral stenosis, spinal cord injury, intracranial neurovascular disease. يعني هسه هاي علما صارت استعمالاتها أكثر شيء اللي هي traumatic vaginal breech delivery, vaginal delivery of a twin infant, and vaginal delivery of preterm infant. Facilitate blood pressure control نستعملها بالpreeclampsia في pre-eclamptic patient. وblunts the hemodynamic effect of uterine contractions. Contraindication إلها شنو هي؟ patient refuse or inability to cooperate. المريضة ما متعاونة، فهذه contraindication إلها. Increase intracranial pressure secondary to a mass lesion, skin or soft tissue infection at the site of needle placement, frank coagulopathy, recent pharmacological anticoagulation, uncorrected maternal hypovolemia, for example hemorrhage، مريضة عندها hemorrhage وبعدها hypovolemia وhypotension. هذه بما انه هذه هم السبب hypotension، اذا هي ما تفيدنا contraindicated، يعني تسوي لنا بعد راح تزيد لنا الhypotension. inadequate training in or experience with the technique، واحد ما مدرب زين فهذا ما مهيئ انه هو ينطي الانالجيسيا. inadequate resources، for example staff equipment or for monitoring and resuscitation. technique لازم شو نسوي؟ لازم بالبداية نحكي discussion ويا البيشنت، نقول احنا ايش راح نسوي. وانترافينوس hydration، هي المريضة لازم انطيها pre injection، لازم انطيها intravenous hydration. A balanced electrolyte solution، for example lactated ringer solution without dextrose is the most commonly used intravenous fluid for bolus administration. patient positioning، شوفوا هنا يا اما sitting up يا اما lying on side position for epidural analgesia. sitting or lateral. There is a little evidence that patient position influence the extent of a neural block during initiation of epidural analgesia or anesthesia. technique: the woman's back is cleaned and local anesthetic is used to infiltrate the skin. The position: an extreme left, lateral or sat up but leaning over flexion at the upper spine and at the hip helps to open up the spaces between the vertebral bodies of the lumbar spine. A. The epidural catheter is normally inserted at the level L2, L3, L3, L4 or L4, L5 interspace. أشوف أني المناسب أخلي فيه الإبيديورال catheter حسب اللي أحصله للمريضة. and should come to lie in the epidural space, which contains blood vessels, nerve roots and fat. The catheter is aspirated to check for position, and if no blood or cerebrospinal fluid is obtained, a test dose is given to confirm the catheter position. يعني شنو؟ يعني أنا راح أدخل الإبيديورال catheter وأشوف هل أنا سويت تروما، هل إجاني CSF، لو إجاني بلاد وصار تروماتيك حصلت. إذا ما حصلت لا بلاد ولا CSF شو راح أسوي؟ test dose أنطي دوز قليلة بالكاثيتر. This test dose is a small volume of dilute local anesthetic that would not be expected to have any clinical effect. The catheter is correctly sited to follow up. After the loading dose is given, the mother should be kept in the right or left lateral position. The blood pressure should be measured every 5 minutes for 15 minutes. Hypotension due to vasodilatation caused by blocking of the sympathetic tone to peripheral blood vessels. This hypotension may cause a fetal bradycardia. It should be treated with intravenous fluid and, if necessary, vasoconstriction such as ephedrine. The mother should never lie supine, as aortocaval compression can reduce maternal cardiac output and so compromise placental perfusion. لازم ما أخلي المريضة تنام supine، لأن إيش راح يصير عندنا؟ راح يصير عندنا hypotension due to pressure on aortocaval compression. Hourly assessment of the level of the sensory block، لازم عن كل ساعة أشيكها. Choice of drugs، شلون راح أختار الدراج اللي أستعمله؟ The epidural solution is usually a mixture of low concentration local anesthetic، for example 0.06 to 25 لحد 0.1% bupivacaine with an opioid such as fentanyl. Combining the opioid with the local anesthetic reduces the amount of local anesthetic required, and this reduces the motor blockage and peripheral autonomic effects of the epidural, for example hypotension. The pain and analgesic requirements vary depending on several factors including parity, stage of labor, the presence of ruptured membrane, oxytocin augmentation, and whether the opioid is administered in combination with local anesthetic. Local anesthetic were administered to block both the visceral and the somatic pain of labor. Intrathecal opioid effectively relieve the visceral pain of the early first stage of labor. هنا عندنا drugs used for initiation of epidural and spinal labor analgesia اللي هي البوفيكين والروبيفيكين والليدوكاين والأوبيويد اللي هي الفنتانين والمورفين. هذين كلهن الدراجز احنا اللي هي تستخدم بالبيديورال وسباينال انالجيسيا. هنا نشوف السايت مال البيديورال انستيزيا زين السباينال انستيزيا، وشوفوا بالضبط وين يفوت وين يدخل هنا النيدل. شوفوا بالابيديورال وين يروح بالابيديورال هنا، بينما السباينال انستيزيا وين تروح تدخل هنا قريب النيرف فايبر راح تكون. شوفوا الاريا اوف انجكشن spinal space subarachnoid space، هذا وين راح تدخل بيه؟ راح تدخل بيه السباينال containing cerebrospinal fluid. هذه بالسباينال انستيزيا راح تدخل هنا ندخلها نيدل. Spinal anesthesia, a spinal block, is considered more effective than that obtained by an epidural and is of faster onset. A small volume of local anesthetic is injected into subarachnoid space. This may be used as the anesthetic for cesarean section, a trial of instrumental deliveries in theater, manual removal of retained placenta, and the repair of difficult perineal and vaginal tears. The spinals are not used for routine analgesia in labor، يعني ما نستعملها روتين لكل patient. هذه needle different size of spinal needles. Complications of regional analgesia: accidental dural puncture during the search for the epidural space should occur in no more than 1% of cases. Accidental total spinal anesthesia injection of epidural doses of local anesthetic into the subarachnoid space causes severe hypotension, respiratory failure, unconsciousness, and death. Spinal hematoma and neurological complications are rare and are usually associated with other factors such as bleeding disorders. Drug toxicity can occur with accidental placement of catheter within the blood vessels. This is normally noticed by aspiration prior to injection. Bladder dysfunction can occur if the bladder is allowed to overfill because of the woman is unaware of the need to micturate, particularly after the birth, while the spinal or epidural is wearing off. Backache during and after pregnancy is not uncommon. مريضة تيجي تقول عندي صار ألم ظهري. Hypotension is now uncommon complication of epidural anesthesia, but can still occur with an epidural, although more commonly with the spinal. Short-term respiratory depression of the baby is possible because all modern epidural solutions contain opioids which reach the maternal circulation and may cross the placenta. Side effects of neuroaxial analgesia: hypotension, pruritus, nausea and vomiting, fever, shivering, urinary retention, and the crudeness of herpes simplex virus, delayed gastric emptying. Conclusion: the delivery of the infant into the arm of a conscious and pain-free mother is one of the most exciting and rewarding moments in medicine. يعني هي أهم لحظة بالشغل كليته. Take the epidural and thank me later. Thank you very much.